Good morning. I'm Sandy Kopp, and I'm here with Dr. Denise Wedel. This interview is part of the activities surrounding the 100th anniversary of the founding of the first American Society of Regional Anesthesia in 1923 by Dr. Gaston Labat. Although this organization is not related to the current ASRA pain medicine, which was founded in 1975, it has been said that the current society would not exist quite like it does today without the work of Dr. Labat and the original ASRA. So it's my absolute pleasure to be able to interview Dr. Denise Wedel. She's an amazing woman, happens to be one of my mentors and somebody that I've looked up to for a very long time. So to have this honor and privilege of doing this today is really great. So welcome, Denise.
Thank you very much. I'm really happy to be here, and I'm glad you're interviewing me, Sandy.
Me too. So let's start with some of the questions that go along with being the Labat Award winner, because not only were you the president, I believe from 1997 to 1998, but you also won the Labat Award in 2012. And so I'd like to just kind of go back in history and ask kind of why'd you choose regional anesthesia?
So at the time I did my residency at the Mayo Clinic, we were doing regional anesthesia in a very defined area only. We did caudals for some of our anal surgery. We did spinals for some of our urology surgery. Of course, we did OB epidurals. We did pain blocks of a variety of sorts. And then, we basically didn't do much intraoperative anesthesia. We did some axillary blocks, and that was it. And when I went into the pain area, because we all circulated in that area, I worked with Dr. Nas and Dr. Wong, and they were really inspiring and a lot of fun. And I did a tremendous amount of nerve blocks, small nerve blocks, major nerve blocks, and I loved it. I absolutely loved it. At the same time, Alan Sessler was our chair, and he really wanted to expand regional anesthesia in our department. So when I talked to him about career possibilities, he said, you might want to think about doing a fellowship in regional anesthesia. And there were really only a few places in the country where you could do that. And one that was extremely appealing to me because I visited it and loved the area was Seattle at the Virginia Mason Clinic. So a couple of the physicians in our department knew people at Virginia Mason Clinic and wrote me nice letters. And I applied there and got accepted as a fellow. And at that time, Manny Batra, Don Breidenbau, Gail Thompson, and Mike Mulray were all on staff. Mike had just joined staff, and they were extremely good instructors, and I was very excited about regional anesthesia. They offered me a job there, but Alan Sessler had already tied me up at the clinic. So with some mixed feelings, I returned to Rochester, and he positioned me then in orthopedics at St. Mary's. And that was the beginning of a battle that we ultimately won. And that turned into, I think, one of the strongest regional anesthesia programs with the help of many other people in the country. It was a very exciting time, actually.
Definitely. Well, and I'm thankful that you came back to Mayo. Otherwise, I probably might not have gotten to know you or as well. So
much good came of my coming back to Mayo as it happened. So that was nice.
Yeah, definitely. So how do you think, you just retired, how, thinking back to when you went to Virginia Mason, came back to Mayo, how did the field of regional change over your career?
So dramatically, it's almost hard to imagine, actually. It went from a procedure that was used very sparingly and with great reluctance, often on the surgeon side, to a part of anesthesia that was felt to provide the best option for most patients. And I mean, that is a dramatic change. And Virginia Mason Clinic did that early. That somehow they worked, and I credit Dan Moore to some degree, even though he was a kind of wild man. But he just put it in the surgeon's face. This is the best thing to do for your patients. This is what we're going to do. And he had the support and built a department where that was just the standing principle. And you almost had to be a little bit of a push. Well, when I came back to Mayo, the orthopedic surgeons were absolutely dead set against it. They didn't want their patients awake. And at VM, I had learned that you didn't have to have a patient awake. Actually, the sedation options are now much improved, but we were perfectly comfortable with putting an endotracheal tube in and giving a very light general anesthetic in those days. And the patients did extremely well, woke up pain-free, et cetera, the same benefits that we see now. And the convincing of some of these surgeons was dramatic. Others, I remember one day, Paul Didier, Steve Rose, and I all went into a room of one surgeon's patients. He had 3 different cases starting. They were all hips, and we were all putting a spinal needle in when he arrived in the hospital. And that about did put him over the edge, but it did open up that particular area. And that's sometimes we just had to kind of barge on through. It was fascinating time, and highly there was a lot of stress when you think about it. I mean, we were confrontational all the time, but it settled down over time. And I mean, I know you experienced some of the same things as you advanced regional anesthesia at Methodist Hospital and came into the same kinds of attitudes that resolved as they saw how excellent these procedures were. But yeah, it was, they were pretty set against it when I came back to Mayo. It was a time.
So when you received the phone call that you had won the Labat award, what were some of your initial impressions or thoughts?
Well, I was surprised, to tell you the truth, because in all of my, and I would accept that I have a lot of skill sets, but research wasn't my major one. And the Labat Award had always been given to major researchers. I had a body of research that I think was significant, but much of it was thanks to Terry Horlocker, quite frankly. Her persistence and drive and, all of the positive qualities you can say about Terry resulted in me being dragged along and in a very good way. And I credit her with a lot of that. So I was delighted. I was surprised. I sat back and thought, well, what would I talk about? I mean, one of my major topics had always been complications. And it was a kind of a crazy way to come into a research area, is to say, I've had all these things happen to me, and be careful, they could happen to you. And I was very open about that. And I think that's why audiences enjoyed listening to my talks about that. But Terry then put numbers on things and helped me define that topic, and then went much further than that in the area of hemorrhagic complications. But so I thought, what about mentoring? Because throughout my time in medicine, what I wanted to do was bring along people, all sorts of people, not just women. I mean, I think Jim Hebel was an amazing talent that I was honored to help mentor. I helped several other people. There are people in our department that are major scientists who came to me for just general life mentorship, which I was always happy to provide from my crazy angle. So perhaps I was no role model in that way, but I could at least see the whole picture. So I talked about mentoring, and I felt really good about that topic, because I felt like people it needed to do that in order to continue building a strong and viable. They're in their own department and in our in ASRA, which I do think is the major voice for pain and regional anesthesia in the world, and needs to mentor young people in order to do that and continue being that voice.
Yeah, I agree. We had the resident meet and greet yesterday, and it was just so nice to see all these young people. But I remember when I was one of those young people and you were there bringing me up. I mean, you and Terry bringing me to these meetings and introducing me to your friends and giving me the opportunities. It's so valuable. I would never have had the experiences I've had if it wouldn't have been for you guys, you know, bringing me here and including me. And so I'm very grateful for that. So
could I make another comment about that, Sandy, not to interrupt you, which I just did, but mentorship also went beyond our own department. And I want to make a strong case for that. One of the issues that we had early on that I felt was a problem in ASRA is that people only brought in people from their group. I tried very hard to be someone who met young people from other areas as well and involved them in ASRA. Kaiser Enneking was one of my favorites, of course, because Kaiser's still a very good friend, but there were some funny stories about that, but we had some wonderful people that we brought in from all over, and even from, of course, European countries, et cetera. So you're right. I mean, some of my, obviously I loved all the people I brought in from here, and you and Terry and Jim were just a legacy that I will always look at as one of my great honors to have been involved with. But we did bring in other people. We tried to open up ASRA and bring in young people from all over.
Yeah, and I think you guys did a great job with that. I mean, you know, I come to these meetings to see my friends, right? My friends from all over. I mean, like you said, you've been all over the world. You know, Joe Neal, other mentors, you know, that just are, that are on the other side of the country, but yet couldn't be a better mentor. So I really think that ASRA is a special place when it comes to that. It's more than just a meeting or a society. It's really truly a group of friends. And I think that's why we all come back to these. That's why, you know, we come to these meetings and come to them and enjoy them. You know, it's not like, oh no, I have to go to that meeting. It's like, I can't wait to see everybody again. So,
right.
So you've named off a few people that were mentors, but who do you think were some of your greatest mentors?
Within the world of regional anesthesia, I would say Don Breidenbaugh was a really strong mentor for me. He was always very supportive, always pushing. Manny Batra was actually the person who pushed for me to be on the board. So, and he was one of the most superb clinicians I've ever seen. I mean, that man could locate a nerve with a single gentle pass. He was a remarkable practice, and still is, I'm sure, but he's retired now. I used to, I have to say, I didn't have a lot of mentorship from older people, and that was the problem. I wasn't from any of the founding fathers groups. So Don was chair when I was out at Virginia Mason Clinic, Don Breidenbaugh. That was super helpful because really I had no other connections with regional anesthesia. So Mike Mulroy, Don, Manny, to some degree, Gail Thompson, although he and I clashed as much as we enjoyed each other, were mentors. At Mayo, Jack Mischenfelder actually helped me with a lot of thinking through issues regarding, he would read my manuscripts for me and help me with that. Roy Kuchera, who was my chair after Sessler. Alice Sessler was a mentor, but he was always difficult to understand on some He was so cerebral, it was sort of above me. But he certainly had my back. I will say that. And that was a huge piece of being able to do what I did. Okay, so here's what I'm saying, I guess. Mentorship was not easy to find in those days. Okay, you really had to push for it, especially I think as a woman.
I was just actually,
yeah.
I was going to ask that. I was just going to say, do you think part of that was just that it was a different time, or do you think it was that you were a woman? I mean, because all of those names you've listed off are all men, and I know who has been involved in this society from the start, and there are very few women. I mean,
Right.
you know, very few.
Totally true. And I think there are multiple reasons for that. The women that I worked with on the board were either pain or pediatric. And Linda Jo Rice was a wonderful pediatric anesthesiologist, but she trained mostly men because she was military for much of her career. Some of the men were really wonderful about mentoring women. Lynn Brodman was amazing. He always did a great job of mentoring everybody. But yes, I had no women mentors at all. Not through college, not through medical school, not through residency. And I think that's why it was so important to me to bring women along. And I encountered a lot of antiquated concepts when I entered the board and all areas of medicine. Most women did not stay in academics because it really didn't allow you to have a personal life in those days. Now it does. And I think that's something that has been incredibly important that we've helped change. So it was a difficult decision to stay in academics, and you were in a constant battle in a way to maintain your position. But then you had unexpected allies all the time, men that you didn't. I mean, honestly, for years, I thought Don Breidenbaugh was the one who had pushed to get me on the board, and I'm sure he was supportive. But relatively recently, I found out that Manny Batra was actually the one that got me on the board. And now that makes total sense, because Manny appreciated the sort of technical aspects of how I did blocks and the way I approached things. And he was always hugely supportive. Having said all that, Sandy, when I got on the board, there was a young group of men with me who were like the same cohorts that you have. John Rawlingson, Manny, Mike Mulroy, Brendan Finucane. I know they all seem old to you because I'm old. But we would exercise together in the morning. And then go to the board meeting and go to breakfast and go to the board meeting. And while we were exercising, and because we were always in these nice places where they had a nice exercise room, we'd talk on the treadmill and or on the bicycle. We'd be next to each other, and we had a lot in common. It was a very interesting time. And so we would talk about the problems we saw and talk about things that we thought might help and talk about where we thought the society should be moving. It was exciting time. Yeah.
I love that.
Yeah.
So let's talk a little bit more about your time on the board and as ASRA president. So you were telling me before we started the interview when you went on the board and how young you were. Can we just talk a little bit more about that?
So I got on the board, I think it was in 1987. So and as I recall, I must have finished my fellowship in 1982 and started at Mayo. Okay. So I was in my mid 30s.
Wow.
And had really, other than managing my orthopedic group, which was small, it was like 6 or 7 people, and we were tight. We were a tight team. They were sort of hand-selected warriors for regional anesthesia. So they had my back, and I didn't have a lot of arguments with them. I had a lot of arguments with our surgical teams, but not with my team. So then I got invited to the board, and it was huge. I mean, it was huge. And I had been very active in ASRA. I had presented multiple abstracts. Finally, they asked me to give a little talk, and I did a good job with that because I like to give little talks, and I'd been doing it since I was a medical student. I'd actually been doing it since I was in high school when I was a storyteller in speech. So so cut me off. Um, I got on this board, and it had on the founding fathers and some other people. And the founding fathers were an intimidating, tight group of gentlemen. And they, in general, brought on their own guys. And so some of the board was a tight group with the founding fathers. They had a loyalty to them. Why wouldn't they? I would have too if I'd had a mentor, but I didn't have one. So I was kind of a loose cannon when I look back on it. First of all, I was being trained to be confrontational. I mean, it wasn't like I was a fading flower ever in my lifetime. But coming back to Mayo and throwing me against the surgeons, which Alan Sessler said, go for it. And I had his support, so I knew I could. That just created this confrontational person who was coming into this group that was very tight and not altogether sure that I was the right person to come in. And you got that sense in the room pretty quickly. It changed. I mean, it changed. That's not an uncommon thing with newbies anyway, or maybe I was oversensitive. That's possible, although I've never been accused of that. So it started out right away with me, learning how to do things quickly. I became the meeting organizer under Michael Stanton Hicks. Michael had a lot of positive attributes, but organization was not on the list. And so that was a completely on me meeting with very little experience doing that. And we pulled that off actually. But I knew that meeting, which was a one horse show, one pony operation, was not the way meetings were going to go in the future. But that is the way ASRA had always done it. So we had a group of speakers, and then you had some workshops, and it was the founding fathers heavily involved in all pieces, which is what the audience wanted. I'm the first to say they wanted to be close to those guys. They were brilliant, all good clinicians, all with such incredible experience that everybody kind of wanted to get close to them. So that was not an issue. But I was presented, by the time I got to be the president, with the dilemma of, were we going to continue in that vein? Were we going to be this small society where a group of people who did a lot of regional anesthesia and pain got together to talk about it and interact with an audience that was like, we think you're amazing and please teach us everything you know? Or were we going to spread out and try to get the whole country on board with what Henrik Kellett was talking about in Europe at that time? So that was the dilemma.
And so how, obviously things changed. And
right.
So how was that?
So that was very uncomfortable. And I'll tell you, I was probably the right wrecking ball at the right time. Okay. I mean, I was young and confrontational, and I had a group of guys that were buddies that I exercised with. We talked about what we felt needed to change. And the problem was not the founding fathers. They were amazing men, amazing. The problem was they controlled so much about the society because they all had a voice on the board at all the meetings. And there were 4 or 5 of them there at any given time. Harold Caron died shortly after I joined the board, or right at that time. So he he was a very reasonable voice from what I hear, but he was not there. But we had most of them. Alan Winnie, John Breidenbaugh, Raj, and Jordan Katz. And they came to every meeting, mid-year and end of year. And they had a way, along with Gail Thompson, who was on the board at that time, of they had a group. They were a group that was very much enjoyed the benefits of the meetings, and they loved teaching, and they loved we spent a lot of money on ourselves at that time. I don't know how else to say that. We stayed in lovely places. We had wonderful dinners. People brought their spouses. But this younger group of us who were exercising together in the morning, we did not. We came to work, and we enjoyed it. We loved the places we were and so forth. But we wanted to make a difference, a change in the way things were done. Right around that time, before I became the chair, ASRA had given us a big grant to do these ASRA workshops all over the country. And it was we felt a great way to get young people who were talented, but kind of isolated in areas that didn't do a lot of regional anesthesia, heavily involved in ASRA, and to get those people groomed so that they could come onto the board. And Kaiser Enneking was a good example from the middle of Florida, in a great institution where she was doing amazing things, but wasn't getting any headway with ASRA because she didn't have a mentor who could get her in. So I was going around the country. I was in charge of that, and I would go to almost all those workshops. This is why I don't like to travel anymore, Sandy. I would go to these little towns where ASRA would set up these models, and we had live models, and we would find these local people and get them in. And then I and another board member would also work with them. And it was great. I mean, it was a great way. So it came down to it that we felt as a group that was on the board then, for the majority of us, not including the founding fathers, that the founding fathers should be involved, but not as involved as they were in making the everyday decisions. We wanted to expand the meeting and decrease the cost of some of the other some of the things the board was doing. So decrease some of our costs by not inviting and not paying for spouses. There were things that were going to become illegal shortly anyway. So it was the time. That was the time. I'm not saying there was anything wrong with it. It wasn't. Everybody did it. But it was going to become more strictly controlled eventually. And so we all agreed that we should propose that the founding fathers be a little less involved with the day-to-day runnings of the board, not have a vote, but be our advisors and come to the annual meeting always and be very involved in it because we needed them, and but not be making the decisions about how we were going to go forward. It was a difficult decision. We knew it was going to be hurtful, and we knew it was going to make people angry. But Don Breidenbaugh was kind of on our side, so that was helpful. And then the rest of the folks who were on the board were solid behind it. So we presented it as gently as we could. It was not well received, but over time, when things settled down and handshakes were made and apologies for hurt were delivered and accepted, and so on and so forth, it became the norm. And I think it allowed the board to expand the meeting dramatically into a 3, sometimes a 4-ring circus. I think we almost got it to be too big a pony show sometimes, but it allowed the options of splitting pain from regional anesthesia. It involved discussions about what was the role of OB, what was the role of pediatrics, how could we make all these things work, because pediatrics didn't have anybody on the old founding fathers group that was supporting them. Pain did, regional and the OR did. And it allowed for other discussions, bringing in Europeans, bringing in a lot of other features. And we really did need to make this move towards, the Henrik Kellett concept of using regional anesthesia as a way to improve patient outcome, not just to improve anesthesia, not just to make the patient comfortable in the acute pain period, but to improve the whole outcome. Things that you, Hebel, Terry, and lots of other people in lots of other places in your generation put together in the package that has made it so important. And that took regional anesthesia into the real world in my mind. Not just a specialty thing, not just a trick point, not just something I could do and the surgeons would go, oh my gosh, that's amazing. But not just a trick, but something that everybody realized was a critical piece of anesthesia. And that's where it lives now, in my opinion. I mean, that's where we've gone.
Yeah, definitely. Well, I mean, it's just amazing to hear these stories and to think about how different things would have been had you not been on the board. And I think it's really amazing. I just, you're a fantastic role model, first female ASRA president. I mean, that's pretty great, actually. I just have a ton of respect. So just one more question, maybe. What was the attitude, do you think, at Mayo with you being on the board and being the ASRA president? Did you get a lot of support, or was that challenging?
It was challenging, actually, but only because of who was, it's so dependent on the relationship you have with your department. So when it was Alan Sessler, he was hugely supportive. When he was followed by our next chair, that chair was less supportive. Actually, then Roy Kuchera was, of course, hugely supportive of any activity outside of the department, and so as was Alan. And then when it came to our next chair, he was more selectively supportive of people, and I was not in his select group. Now, on the flip side of that, I had more effort to be allocated to the board on my part, because I was truncated at work a bit. I was not allowed to expand my ideas at work. Other people took on that role, but that gave me more time to actually focus on ASRA, and then ultimately my next role, which was IRS, which was directly related to my role in ASRA, quite frankly, because I became the editor for regional anesthesia and pain medicine for IRS for that journal. And that was directly related to what I was doing with ASRA. So that gave me an opening. And there's never an issue that doesn't give you an opening somewhere else, as you well know. And if you have your eyes open, you can just say, okay, this road's blocked for a while. I'm going to take this pathway for a while. And that pathway can sometimes turn into a super highway. And that's fun, so, and I had so much support at ASRA, just as you described. It really was family. It really was just a relief to see those faces again. And you go to the same, national meetings and see everybody. You can go to regional meetings and see everybody. It's just a delightful way. And now you've split with 2 meetings. You can go to 2 meetings and see everybody. And then, of course, the brilliant concept of doing the education committee, which I was on for many years. And the leadership of that was John Butterworth and Terry Horlocker and other folks, Jim Eisenack, who started it. That was a brilliant also. So you had all of this face time with these people. It was really lovely, brilliant. We really pulled the best in, and we had room for them. And as much as after the vote where we decided to ask the founding fathers to take a lesser role in the active leadership. There was a big dinner that night. We were up in Quebec City, I remember, and I was sick. I went to my room. I was just, it takes a lot to do those kind of confrontational things. There's a lot of energy expended. That is all I'll say. And people don't realize it. They think you enjoy that. You never enjoy that. Nobody likes confrontation. But somebody has to, there are times when somebody just has to be the leader of that, get a consensus and move ahead. And I know you've been in that position as well. And there's just no way around it except to just meet it head on. That was hard. But it all resolved as things do if it's done with a good heart, I think. And I'm so impressed at the way ASRA has grown and what it's doing now. It's an amazing organization.
Yeah, it truly is. I'm so happy to be a part of it. It is just thrilled. So I want to end this. Well, I don't want to end this. I could sit here and talk to you all day.
And I could talk all day.
But the way that we've been trying to wrap up these interviews is by asking what 3 words come to your mind when you think of ASRA?
I would say ASRA is the prominent voice of regional anesthesia and pain medicine in the world. That's more than 3 words, I'm sorry. Prominent, the regional anesthesia pain medicine. I consider that one word, okay? But I think it's developed into the leadership of the world in this field and in a broad area of this field, which I foresaw. I would have said, I would have predicted, honestly, because the best people were coming into it. It's an impressive. You belong on that board, by the way, and I'm delighted you are. But I just think they have taken the best of the best and pulled them in, and accomplished so much, and done it in a very good way, in a very measured way. When Jim Eisenach set out all the educational goals and what needed to be hit, that was brilliant, truly. I mean, that's a brilliant mind setting out a brilliant plan. And ASRA's managed to kind of follow along in that, which is impressive. And then just brilliant minds. I'm so proud of all of you and of the way ASRA has developed. It was a small society when I joined. We all knew each other. Everybody knew everybody.
And everything about everything.
And everything. Too much. Don't go there. But yeah, it has really changed in a positive way. It's become more professional, more a voice for everybody and welcoming to everybody, which has been great. And a lot of women involved, which has been awesome, because who isn't good with their hands? Let's see, men and women both, but I would lean towards females. They have those tiny little hands that can do anything. I always think of Terry Horlocker's hands when I say that. But it is, it really has developed in a lovely way for inclusiveness for a lot of people.
Well, and I think we owe a lot of that to you. And I look at the people who are involved and I remember during your Labat lecture, you put up the tree of people and there's a lot of branches that stem from you. And so I think ASRA and myself personally, we owe you a huge debt of gratitude for all that you've done for the society and all you've done for regional. I mean, it's amazing. And I'm proud to know you. So I'm hoping that you can come to the meeting in the spring. So we're trying to get everybody to come back.
Okay, great.
So yeah, hopefully we'll see you there. But thank you so much for taking the time today to do this interview. I've been looking forward to this since we started talking about doing these interviews, and I look forward to hanging out with you and having dinner at the next meeting. So
Thank you, Sandy, and I appreciate that. And I think it's funny that we live in the same city, but we probably have to meet at a city at some distance. But that is the way it is. You are in that part of your career that I remember well. But thank you for interviewing me. I appreciate it.
Thank you.